The county's numbers, today's numbers are our total count is 258, 227 are confirmed, 2,023 are probable. We have an error in that. 2,231 probable, 2,780 negative, 76 pending, 152 recovered. There's 6 deaths, 3,083 total tested, and contacted are 2,195. Per Department of State Health Service guidance, the Ector County Health Department will be including the probable cases to our total case count, as it gives us a greater understanding of the full impact of the disease on the community. Counting probable cases is a long-established integral part of the epidemiological investigations, and it increases the overall sensitivity of the surveillance system. As per State Department of Health Services proposed prioritization of COVID-19 case investigations, Ector County Health Department is only investigating probable cases of COVID-19 with presumptive laboratory evidence history. This prioritization is based on our work capacity. Equal amount of work goes into investigating probable cases. Case investigators interview reported probable cases to confirm that they meet probable case definition, and then our contact tracing teams work towards reaching out to the contacts of that probable case going back to 48 hours before the symptoms started. And the health department will continue to provide breakdown of the confirmed and probable cases in Ector County. And as the number of cases increase in our community, people must continue to take precautions. And some of the recent cases that we're noticing are related to travel. And if you're going to travel, please make sure that you're protecting yourself and those around you by wearing a mask, washing your hands, using hand sanitizer, using the hand washing. And when hand washing is not available, not touching your face. And if you are ill, stay home. And on the nursing home update, the Deering's Nursing Home had received results for 46 residents and 21 staff members, all of which were negative. And the county updated its website to where you can get on there and see case information. So if you get on the website, you can just see how the cases break down as far as male, female, age, how they were contacted, and everything like that. That's a report from the county, Trevor.
And again, that was 31 probables, correct? 227 confirmed, 31 probables.
Yes.
Okay. All right. Thank you, Commissioner Shelton. Russell is on the Zoom call, but he is traveling, so I'm going to be reading the numbers for MCH. MCH numbers has 140 positives. That's an increase from 7 yesterday. We continue to have 13 positive patients in-house. 7 of those are on 7 Central. 3 of those are from the Focus Care in Odessa. We have 6 on our critical care unit, 2 of those from Focus Care, and we do have 2 people in our critical care unit on ventilators right now. We have 1,447 negatives, 59 pending, no PUIs in-house, and with a total of 1,646 total tested. So those are the MCH numbers. Kristen, do you have anything you'd like to add as well?
No, I don't have anything today, Trevor.
All right. Stacy, would you like to go over the ORMC numbers?
Yes, Trevor, thank you. Odessa Regional has tested 463 individuals. We have 26 of those who were positive, 431 negative, and currently have 6 of those pending. In terms of our in-house patients today, we only have 2, of which one of those is on a ventilator. And that's my report, Trevor.
Thank you. Dr. Saravanan?
Thanks. I'm going to share that screen now, Trevor, if that's okay.
Okay, there you go. Should be able to.
Okay. So what I'm sharing right now is from Johns Hopkins University. It's a coronavirus resource center, and instead of looking at projections for the future, we're looking at data that we already have and the data that we know right now. I'd like to point out 2 things. One is if you click on the View COVID US map, it's going to show you a heat map of where the majority of the cases are. You can actually pick it by county. So let's go ahead and pick the county, our county. And when we pick our county, it's going to break down a few things that I think some of you are going to find very interesting. We have this data locally as well, but this is it's beautiful, it's colorful. I thought it would be nice for us to look at. Look at the age group distribution right here. You'll see that over 65, which is in orange, and over 75, that's in red, is tiny for our county. The majority of cases, as you can see, are in this age group, 35 to 65, and then you can add in some of the younger ages here as well. And so my point being, the people that are being affected the most in our county are of the working class population that's actually going out and engaging with the community. And that kind of makes sense because this is all coming from social gatherings. So take note of that. The split between our ethnicity, Hispanic versus non-Hispanic, I think it's starting to mimic what our normal population distribution is. So nothing majorly surprising there. There is still a slight disparity which put Hispanics at higher risk. That's not surprising because that's normal for most disease processes to have usually a higher risk for that population. Another one that you can look at here is total utilization. So for us right now, it tells us we have 34 reported ICU beds available. We have a few more than that locally, but that's what these guys are collecting with regard to data and what the utilization is of those. So this is a good status report to look at, and it's updated daily. So I thought that would be good. The other thing I want to show you on the Coronavirus Resource Center website is this: have states flattened the curve? I think that's an important question. So if you look at the US map, and these are little graphs that are placed like the US map, the green ones are the ones that are showing that have started to flatten the curve, and the red ones are the ones that are showing that have not flattened the curve or are back on the rise. So you've seen Arizona on the news, and you can see the big red around Arizona right here. But Texas is where we want to concentrate. So if this shade was green, that would mean that we have flattened the curve and we're achieving control. If it's red, it means that we are back on the rise. So this graph is showing from middle of March up to now. And if you look at this graph, you saw the rapid rise towards the end of March. You saw somewhat of a stabilization in April. You saw in early May a fall in our cases. And then you see a rise again since mid-May until all the way to now, since late May all the way to now. So that's what I kind of wanted to point out. So as we talk about what's important to our community going forward, and I've said this several times, if we are going to look at our data and say, where can we make the most impact? Our data currently tells us this disease process hasn't been through our community in full force. So the part that we can still make an impact on is preventing this disease process from coming into our community. So if you're going to walk away from all of this, and if you're going to monitor this data on the website that I shared, that's what you need to have a realization of. And it's not somebody telling somebody what they should and should not be doing. It's a community decision of what we think we need to do to keep everybody safe. So the mayor can come out and say, yes, you should all wear masks, but there's no way to enforce that, right? If you're not wearing a mask, we're not going to write you a fine. We can't do that. So it would be good to make that statement, to say, yes, we should all wear masks. And us as a community should make that statement. But even though it can't be enforced on the community, it's a social contract that we have with each other to enforce that kind of thing. So I just want us to understand that as a community, we still have the opportunity to keep this at bay and not let it get out of hand. So I'd like us to keep engaged in that and keep it at bay. Thank you, Trevor.
All right, thank you, Dr. Serafinin. Mayor Turner's with us as well. Do you have a few words before we get to media questions?
Sure. I just want to thank everyone for what they're saying. One of the things that we're going to have to do is keep reminding. With advertising, you have to stay in front of people. The chamber is actually working with the city to work on an advertising plan. Will be in English and in Spanish to get this out to the community. Because we've all used social media, but we want to make sure we reach all the population. And that way we can use some Hispanic advertising to target the Hispanics some English to target English. So that's in the works, and hopefully we'll be finished here in the next week.
All right, thank you, Mayor Turner. Looks like we got a full house today. Mike Merlot, Odessa American, you're up first.
Yeah, hey, I guess this question could be for anyone who knows. If someone tests positive from an antigen test, does that mean they are currently infected with COVID-19?
I thought we were friends.
Yes, Mike, if you're asking about the test that we do, the PCR, the swab that goes to the lab and it comes back positive, that's what you're asking about? Yes, that's what it's testing for. It's testing for whether or not you have the virus.
Okay, and then is the antigen test, is that 100% accurate?
Are you talking about
antibodies?
Antibodies.
Yeah, so that's not.
So no.
Just because you show antibodies doesn't mean you're actively positive for COVID. There's a window of time where you could be positive as we build those antibodies, but it doesn't mean that just because you are positive for antibodies means you're positive for COVID.
Right.
Mike, antibody is an indirect test. You have the antibody because you could have been exposed to the virus, so it's indirect. The direct test is an antigen, and when you use that word, the antigen is when you actually do the PCR and look for the virus. So that's what we send out to the lab normally. The antibody is an indirect test, so that does not prove whether or not you have it.
Okay, well, it's a question from a reader. A reader wanted to know, they had a friend who had tested positive after an antigen test. And then I guess the health department had called their friend and said they were going to list them as probable. So that reader wanted to know why.
Because there is a period of time where if you have an antibody test, we send them, at least with medical center, when we do an antibody test, we do send them for a PCR because there is a window of time that you can be COVID positive.
Right. So just to clarify, they use the word antigen test.
And that's not what we use.
That's not the same thing.
Okay.
That's not a thing. That's not something we talk about. So it was probably just a misunderstanding of the wording.
Okay.
So we don't say antigen test for anything.
Right. Okay.
Related to COVID.
Okay. All right. And then I guess for, CBS 7 had reported that prom type party. I don't know if anyone had seen that. I guess it's, to be hosted at a local venue for local high schoolers who missed out on graduation. Is that a good idea? Is that?
Yeah, Jake called me about that. It was a couple of days ago. He told me about Rolling 7 hosting this event for high school graduates. Obviously, they can have up to 1,500 people in there, which is, I think, their 25 or 50% capacity. I forget what it is. But legally, they could have that many in there, still following the regulation. The issue is, are those people going to socially distance? So this is how I answered Jake, and I'll give you the same answer. I said, life goes on. Nobody's trying to prevent anybody's life from going on. What we need to understand is how life goes on is now different than how it used to go on before. This is during COVID time. So there is a new normal, and I think us as a community need to understand what that new normal is. If we can all be engaged in that same conversation, if everybody that is attending this event is understanding of what socially distancing means, what wearing a face covering means, and what it means to not be able to get up on the dance floor and be all together right next to each other. If we can all understand that, then this is fine. We can do this. I mean, we have to live our life. It doesn't end, right? So one of the comments on the video that CBS 7 posted on that story, somebody had said, well, everybody has to make their own personal choice whether they want to attend or not. we're not talking about the people that are choosing for their health, whether they attend or not. We're talking about them affecting other people in the community. So it's a bigger decision than just personal. It's not just about you, but it's about your uncle or your grandma that you're going to go home to. It's about your friends that may have those high-risk population that they might expose this virus to. So the answer is not, no, you can't have these events. I mean, obviously, we're trying to reopen and trying to get back to some kind of normal. It's just we all have to agree on what that new normal is and how we're going to achieve it safely.
Well, thank you. Appreciate it.
Mike, you good?
That's all I got.
All right, Scott, are you at your desk? All right, we'll go back to Scott. Danny?
Hey, Mr. Mayor, has anyone asked to rent out any of the venues in the parks, the activity centers?
I'd have to check with Steve Patton at Parks, and I can check. But from my knowledge, there's nobody that's asked for those yet. But I can look into it and get back with you, Danny.
Okay, and would you, if they're available, would you ask for a plan of safety for the people holding that holding an event there?
I think that is prudent. I think we need to ask what your plans are to protect each other, especially now as we see the numbers go up.
Danny,
So I believe, go ahead.
I was going to say, can you repeat your first question so I can find out for you?
If people have asked to rent out any of the activity centers at the parks for family reunions and stuff like that.
Okay.
And there would be a limit to how many people could be in there, right, Mr. Mayor?
That's correct.
Okay.
That's
All
correct.
right. That's all I have.
All right, Danny? Looks like Scott's still out. I've got a few others. Let's see. Melissa, are you there? No. Dylan?
Hey Trevor, I got a few questions.
Okay.
Okay, so for the hospitals, how has the testing been since we've reopened? You know, has it increased, has it decreased, or has it been about the same, you know, whenever it comes to testing people every day?
Definitely an increase in the amount of testing. Definitely an increase in the positives since the testing has gone on. I think NCH has seen the lion's share of those positives very recently. So, Kristen.
Yes, we're absolutely seeing an increase. We're averaging 14 to 20 a day that we're testing and either admitting or sending back home to be quarantined. So yes, medical center is seeing the volume of the increase within our community.
Okay, thank you. And also, you know, with the shutdowns that kind of happened in April, you know, Ector County, just in the April time period of things being shut down, there were 67 confirmed cases. And then you go and you look and things opened up in May, there was 81. You know, we're pretty much halfway through June and you know, there's 67 so far. You know, how is that kind of just a determination of how effective the shutdown was? And, you know, if there's a threshold, like when can is it possible that we see another shutdown, you know, if we kind of hit that threshold of things spiking, you know, like we're seeing right now?
That's exactly right, Dylan. And you hit the nail on the head when you said you can see the effect of the shutdown. But that's not where we want to go back to, right? I hope we never have to go back to that, which is why I pushed the point on there is a new normal and we can achieve a balance of safety and being able to live life and still do what we need to do. And still keep that same, still achieve that same effect that we achieved with a full shutdown by controlling the curve and bringing the cases down. But yes, we do run that risk if we don't follow through with that kind of philosophy to have a huge spike. And then obviously the decision is taken out of our hands and there are certain things that are forced on us, like a shutdown, if that's what it comes down to. And I really hope not, Dylan.
Hey, this is Russell. Can you hear me?
Yeah,
Yes.
I hear you, Russell.
The question about that, and Doc, thanks for that comment, but the worst possible scenario for us to go through right now is another shutdown. And that's why it is highly important that people put on their mask. Another shutdown would be, the first one was catastrophic enough. A second one would just be a total bomb. And I just can't stress enough how important it is for people to wear their mask. You're not just protecting other people, you're protecting yourself. And it's our responsibility to mask up and to make sure that we're doing our part, because there's some businesses out there that another shutdown, even a partial shutdown, they would not be able to recover from this. And we want to make sure that it doesn't happen again. And the way you can do that, the way you play your part, is to wear your mask. That's all.
Well, that's the whole reason for opening up in segments, okay? Easing back into this thing. And, that's been our biggest fear. We get 50% open. Now everybody just thinks everything's back to normal, but it's not. I had a phone call today from a lady that's got COPD, so she's compromised. Well, she can't get family and friends to wear a mask. They're like, well, I don't have symptoms. I'm not affected, but she is compromised. If they were to be asymptomatic and possibly give her the disease, then she's much more at risk than they are. So they're not just protecting themselves, they're protecting everyone else's health. Well, and like Russell said, we're also protecting everybody's health of their business. A shutdown would be catastrophic. We're just now starting to get the wheels of commerce slugging through, turning slowly. We want to keep the wheels of commerce climbing and going, and that's why we ask everybody to have a plan before you do anything. Go to the grocery store. Have a plan on how you're going to do it safely, COVID safely.
Well, and you can look at the individuals and what it's done to their pocketbooks, not being able to work and just getting limited amount of money from the government. People have really struggled there. We've seen the food bank giving out more food than they've ever given out and things like that. So it's really put a stress, and that's why, we've always said, you are setting how our community responds to it. Each one of us has a choice, and we have to make the good choice and wear the mask.
All right, I think my last question, with cases spiking, especially here in the state, is this kind of characteristics of a second wave that's coming here in the state of Texas, or is it kind of too soon to tell at the moment?
Dylan, this is not a second wave. This is still part of our first wave. We haven't seen this go through our community and leave before we have a second spike. Scientific definitions are different, and we'll put those aside. But I will tell you, this is still part of the first segment of this disease going through our community, and we're not over it yet. So we do need to control it. The second wave, if there is such a thing, is anticipated when the temperature drops. It's anticipated somewhere in the fall. And I think if we can get it right this time, we will definitely get it right next time. Just think about the repercussions of what could happen in the fall. With the schools, they're still already thinking about, okay, are we going to reopen? Are we not going to reopen? How much are we going to reopen? Who's going to show up? Who's not going to show up? All of these decisions are still being thought about. So if the community responds in a way that shows a certain level of responsibility and accountability, I think it'll make it easier for the schools to make those decisions, to say, okay, our community can do this. We trust that we're going to be able to keep our kids safe and our parents safe and our teachers safe, and we'd be able to open. We have the kids at home right now, and I can tell you I'm ready for the kids to go back to school. So I'd like our community to be able to follow those regulations come August. I want the kids back in school for in-class education. So I think it's all of our responsibility. Like I said, it's a social contract between all of us, not one person telling another person what to do or what not to do. It has nothing to do with our freedoms as a person, as a citizen. It has more to do with our social responsibility, and that social responsibility is shared. It is not one of these people that's on this call that can make that call to say, I'm going to control this disease by this order that I place. Well, that's not how it works. If all of us are not engaged, it's just not going to happen.
Evan, do you have something to say as well?
I did. This is just, I just got off the phone with Steve Patton, our Parks Director, and got some information for Danny. So our park community buildings and picnic pavilions opened up for rentals on the 1st of June. For the community buildings, there are specifications of no more than 50% of the building capacity for attendees. And for picnic pavilions, you know, everyone has to practice social distancing. But an update that Mr. Patton had was that due to the increase of cases that we've seen, there will be no special events at any park facilities until September the 8th. And then on September the 8th, they will review everything and see if they can begin allowing special events, or if we need to postpone that date for a little bit longer.
You good, Danny?
Yeah, got it. Thank you.
Trevor, I'm good too. Thank you. Thank you.
All right. Scott, joining us again.
Hey, yeah, sorry I missed my first round. This conversation just makes me think of stuff that's been going on this week. That we did a story yesterday about a company that wants to have a prom for Midland County upperclassmen, and we're the bad guys, if you read our Facebook page, for asking, is it smart to have 500 to 1,500 hormonal teenagers rubbing up against each other one night in the upcoming weeks? The Midland Health Department says they don't want to have anything to do with it. Use your best judgment. Here's the CDC guidelines. We have Jay Hendricks and Kristen telling us all day, every day to mask up, yet most people don't. We've been to the stores. We see reality. I just wonder, you know, we can sit here and talk amongst ourselves about what to do and best practices, but I just don't think it's going to happen. So, you know, I posted a story the other day that we're up 25% the first few weeks in June, and I'm scaring people, even though it's just math. So what do you think? I mean, I don't think we're going to change anybody's mind. If they're not going to wear a mask, I don't think they're going to wear a mask.
I can start off a little bit with that, Scott. This is one of the discussions we had at a recent community stakeholder meetings. We've been having these meetings for the past couple of months, where pretty much all the community leaders come in, and we try to talk about updates from each of our organizations and how to help the community try to deal with this better. So one of the things we talked about is the way in which we're approaching the community. We've been telling the community, don't do this, this is bad for you, this is bad for you. So one of the approaches that we're going to take that's different going forward, exactly because of the comments you made, is because what we're telling them to do, they're not doing, they're unwilling to do it. So one of the approaches we're going to take that's different is, we know they're going to do certain things. We're going to get ahead of it and tell them how to do it safely. And that's the difference in approach. So they are going to have parties, they are going to have events, but we're going to try to get ahead of it and try to tell them how to do it safely. Eddie, do you want to tell them a little bit about what we talked about and what the health department can do locally?
Well, that's exactly right. We need to educate them. And Scott, you're just telling them the facts. That's just numbers. And that's all we've been telling them. And we want to get ahead of it. Like Dr. Saravanan said, get ahead of it. But again, there's no teeth to what we tell them. There's no, we can put requirements on them, but a requirement without enforcement is just merely a suggestion, right? So that's what we want to do. We want to educate them. So we have holidays coming up. Social gatherings have proven to be the big event that gives us a bunch of cases, okay? So we have Father's Day coming up. That's our next holiday. What we want to do is we want to educate them on how to enjoy Father's Day without getting father sick. Okay, so realistically, so each event that comes up or each activity that they have, hey, reach out to us, ask us, hey, what do you plan on having? Just like they reached out and said, hey, can we do this 500 person graduation? Well, I mean, you can, but it's not smart. It's not safe. There will be repercussions. So if you are to do it, you must have masks for everybody. No hugging. I mean, do the elbow high fives. Stay the six feet away. But practice it. I mean, this is a season in life that we're going through. It's a tough season. We've all had tough seasons in life, but now we're all in the tough season together. Let's just do what we have to do to be smart to get through this season, so we'll have another season of life. So our loved ones will have another season of life. I mean, the demographics are showing that people my age are getting it. I'm a father. Father Day is coming up. I want to have another Father's Day. And so we're going to try and educate everybody, put it out there in English and Spanish and be available for anybody that has questions. And all we can do is feed them information and encouragement. That's kind of our plan at this point, Scott.
Got anything else?
Early announcement, Kristen's our new noon anchor. She starts Monday.
Surprise, Russell.
We've been meeting at the barn door doing paperwork. So she signed today at lunch. Thank you all very much.
All right. Anybody else have anything to say before we close out?
Yeah, I just had a follow-up. I was wondering, Eddie, if we could get a copy of the safety plan for the gun show.
Yeah, I'll see if that's possible. I haven't seen it, but I'll reach out and see if I can get it.
Perfect. And then I don't know about this, the test and the semantics of everything, but I found the name of the test that was referenced in that question. It was called the Sophia 2 SARS antigen. Does that ring any bells? Does anyone know about that test? Supposedly it was from Signature Care in Odessa.
So from my understanding, Signature Care in Odessa is doing the 15-minute rapid testing from Abbott, but I'm not absolutely for certain on the name of it. We can always find out for sure, and we can respond to one of our readers. If Trevor, if you know who it is specifically, and in that way, they really do understand the answer to their question, and we can make sure you're included in that, Mike.
Okay.
From what I've seen on the FDA, and Dr. Saravaner, Kristen, correct me or I'm wrong, an antigen test is something I believe that the test just for that virus, but it does produce quite a bit of false negatives, so it almost needs to be reconfirmed with a PCR test. It's not always accurate. Would that be a correct assessment from the FDA?
I don't know for certain about the Sophia SARS antigen. That one is a fluorescent immunoassay. It is an antigen test, but it's not a PCR. I don't know if it needs to be, if it needs a confirmation, if that's what you're saying, Trevor. But I can look it up and tell you next time we meet, Mike.
Okay. And does the county know about that? Because the question was kind of directly to the county, just about why that would be why would be a probable positive instead of just a positive.
I don't know if Eddie's still there, but the FDA says the positives are usually likely, that they're highly accurate on the positives, but there's a higher chance of false negatives. But I don't know if Eddie has anything else you want to add.
Yeah, I don't know anything about that. I can check with the health authority and see.
Yeah, that would be great. Could you check with them, Eddie? Thank you.
Trevor, how are we doing on supplies as far as rapid supplies? Are we getting some from the state, or with increased numbers, are we using them all up?
Kristen, I know MCH's supplies.
So we have the PCR testing, which is out of our Cepheid. We don't have the 15-minute Abbott test. So ours takes 45 minutes to 50 minutes to run, and we order those separately. We're not getting them from mean, the state, although the state does allocate kind of where they go, we are very limited in our numbers, and we don't know when our next shipment is going to be here because of some manufacturing issues, is what I was told this morning.
Okay. Thank you.
Anything else?
Hey, Mayor, did you get your negative test results back? Did
Yes,
you
sir,
get?
and I've been released by the health department.
Okay. All right. Thanks. That's
Mike,
all I
there's
got.
a PDF that I shared as well on the chat box, so just make sure you download that PDF. It'll give you more information about the Sophia test.
Okay.
And
Thank you.
Trevor, I did have one more thing I wanted to say sort of to all the media. I think we have 4 different stations here. You know, you guys have space to run public service announcements. You could choose to run those announcements anytime you want. You could run them at the middle of the night when the least number of people are watching and still meet all your requirements, prime time. So if you guys can help with that, we'd appreciate it a lot. Thanks for that smile, Scott.
Peek out of the corner.
You
All
know
right.
we're doing our part. Come on. You're
All
just mad we didn't reach out to RMC first. But we got the lovely Kristen from MCH.
Man. Another.
Stop.
All right, we will be back Monday. I'll finish this out with something from Romans 8:31. What then shall we say in response to these things? If God is for us, who can be against us? See everybody on Monday.